Well, take a look at this. Reacting strongly to Prime Minister Narendra Modi's attack, West Bengal Chief Minister Mamata Banerjee said that Operation Sindoor should not be used as a political tool. She said that the Prime Minister has made inaccurate statements about us, seemingly only to serve his rally agenda and stir controversy.
What Modi ji had said today, we are not only shocked, but it is very saddening to hear the voice of Prime Minister when all the opposition team, they are representing the country, the world, they are taking bold decision to protect the country's interest, national interest. Obviously, always we protect the country because it is our motherland. We will do that. But at that time, is it the time for Narendra Modi, Prime Minister of this country? And his presence of him, his minister said, like Operation Sindoor, they will do the Bengal operation also. Operation of Bengal. I challenge them. If they have the guards, you go election for tomorrow. We are ready and Bengal is ready to accept your challenge.
Well, an open challenge to the BJP, and earlier in the day, Prime Minister Narendra Modi targeted the Mamata government over the recent violence in Murshidabad and Malda, alleging that hooligans were given a free hand in the name of appeasement and the police were reduced to mere spectators. Listen in to what the Prime Minister said.
पश्चिम बंगाल को अब हिंसा की, तुष्टीकरण की, दंगों की, महिला अत्याचार की, घोटालों की राजनीति से मुक्ति चाहिए। अब पश्चिम बंगाल के सामने भाजपा का विकास मॉडल है। आज भाजपा देश के कई राज्यों में सरकारें चला रही है। देश के लोग बार बार भाजपा को अवसर दे रहे हैं। पड़ोस में असम हो, त्रिपुरा हो या फिर ओडिशा, यहां भाजपा सरकारें तेजी से विकास कार्यों में जुटी है। मैं बंगाल के सभी भाजपा कार्यकर्ता साथियों से कहूंगा, हमें कमर कसकर तैयार रहना है। हमारे सामने एक बड़ी चुनौती है कि लोकतंत्र पर पश्चिम बंगाल की जनता के विश्वास को फिर से कैसे बहाल करें। हमें पश्चिम बंगाल के हर परिवार को सुरक्षा की, सुशासन की और समृद्धि की गारंटी देनी है।
Well, next up, a focused segment. Because one has to remember the sirens, the silence, the smoke. When India burned under the weight of COVID-19. When Delhi gasped for breath. When we counted pyres instead of people. And yet today, as COVID cases are on the rise again, Delhi's health minister says there is no COVID. It's just a scare. Hawa banaya ja raha hai. And this at a time when the country is sounding alerts, issuing advisories, reopening wards, inaugurating new ones, like you can see. And at a time when COVID cases are on the rise, deaths due to COVID are being reported. And I agree, this is not as bad as the peak of the COVID rise in 2022, the Omicron variant, the Delta variant. People running from pillar to post, lockdowns and its ripple effects, people gasping for breath, quite literally, dialing frantic calls to arrange for oxygen cylinders, the many pyres that burnt simultaneously. And now the country, including the national capital, is reporting a surge in COVID cases. Delhi's Health Minister Pankaj Kumar Singh's exclusive statement to News 9 on COVID-19 clearly shows his ignorance and, of course, the ground realities. There is no COVID. जैसे हमारे यहाँ बिहार में कहा जाता है, हवा बनाया जा रहा है। कोविड नाम का कोई विषय है ही नहीं। Before we move on, listen in to that exclusive tic-tac with my colleague Ruchika, where the Delhi Health Minister uttered this statement.
There is no COVID. Right now from till 11 o'clock there is no COVID. हमारे यहाँ बिहारी में कहा जाता है हवा बनाया जा रहा है, ये सिर्फ हवा है। आई एम इंश्योर करते हैं कोविड की कोई विषय नहीं है। कोई 2-4 पेशेंट एडमिट हुए तो उसके लिए हमारे हॉस्पिटल तैयार बैठे हुए। पब्लिक को रिलैक्स रहना है, पैनिक ना हो। कोविड के विषय कुछ नहीं है।
Well, with the country reporting numbers, some deaths being reported from Maharashtra, Kerala, the health minister saying that there is no need to panic, well, doesn't really sit well. And whilst countries are ramping up precautions, India too, with 1,010 active cases, we're also on alert. There is no need to panic, but we are on alert. Delhi alone has reported 104 active cases till now. No deaths, fortunately. But even as numbers climb, Delhi's health minister's statement seems far from reality. And this even as the government is ramping up precautions, inaugurating new COVID wards. Then why the statement? Let's listen in to this exclusive reaction once again.
There is no COVID. Right now from till 11 o'clock there is no COVID. हमारे यहाँ बिहारी में कहा जाता है हवा बनाया जा रहा है, ये सिर्फ हवा है। आई एम इंश्योर करते हैं कोविड की कोई विषय नहीं है। कोई 2-4 पेशेंट एडमिट हुए तो उसके लिए हमारे हॉस्पिटल तैयार बैठे हुए। पब्लिक को रिलैक्स रहना है, पैनिक ना हो। कोविड के विषय कुछ नहीं है।
So is the minister blind to the data? Is this ignorance or indifference? Is this how we honor the memory of the thousands who died due to COVID-19? Why undermine science? Why insult the survivors? Let's talk about this as well a little bit. Nirmamta Gupta, spokesperson of the BJP, with us on the broadcast here. Dr. Nimi Rastogi, spokesperson for the Aam Aadmi Party. Nirmama, how does one justify such ignorance? You heard the Delhi Health Minister as well. I understand he could have used different set of words, but why didn't he? And he's the Health Minister at a time when COVID cases are rising. I don't even have to dramatize this enough because of what we saw in 2022. This is certainly, comes across as a very insensitive remark.
Good afternoon. So, just to say, I don't think he meant it in those many words as it's been interpreted. Basically, it's more to focus on the fact that it is clearly not alarming. And the situation should not be projected in an alarming way because, as you correctly said, there have been no casualties as per se. People are recovering fast. And as if you take the science part of it, which you had referred to, these two new variants are NB 1.8 and LF.7, according to the data from the Indian SARS-CoV-2 Genomics Consortium. And as of now, WHO classifies both these, that is the LF.7 and NB 1.8, as variants which are under monitoring and not variants under concern or variants of interest. So the patients which have been admitted and are receiving treatment are recovering okay. In fact, last week, the Delhi government, as well as the Chief Minister of Delhi, issued an advisory to all the hospitals, asking them to ensure availability of beds, medicine, oxygen, so that all necessary steps are taken. At one point, this was a territory which we were not familiar with. Today, the familiarity is much more because we've all been through the pandemic. Also, let me go a step further. Daily updates have been submitted to the State Health Data Management Portal with adequate testing. Testing requirements like include the 5% of the influenza-like cases and also.
Let me come in here. Let me interject. And my apologies. See, we understand that there is no need to panic. Things can be under control.
No, I'm also saying steps are being taken.
Steps are being taken. We've learnt our lessons over the past waves. And we better be putting the best foot forward at this point in time. But, his words being taken out of proportion, being misinterpreted, I don't think it's going to go that way because he uses Hindi as well later on. He says, जैसे हमारे यहाँ बिहारी में कहा जाता है, हवा बनाया जा रहा है.
Also that.
I mean, do I need to put on the death toll? We are already sitting at 6 deaths since, the past fortnight itself alone. And I'm glad, and it's fortunate that Delhi has not reported any casualty. But that health ministry data is also till the 26th of May. We're still learning of 2 more days of data.
See, data is being updated as and when. In fact, expert advice, which are also saying take rapid antigen test, to PCR test. In fact, under our government, healthcare is seeing major reforms. If you see the hospital treatments for everything, as you said, a COVID ward.
Then why utter this unscientific statement?
Can I just say, because sometimes words are used which do not have the same intention as they've been interpreted. I think he was just saying there is no alarming situation in as many words. If the situation was not like that, I mean, our chief minister herself has said all beds, all necessary facilities are ready. Nobody is underestimating a virus which has, one doesn't know the prediction of a virus. We've all seen what happened in the recent pandemic. So nobody is saying that it's nothing for the future. But as on date, it is definitely not alarming. As I told you, these two variants were being declared by the WHO that these are manageable situations. So nobody is underestimating it, and neither anybody is mocking the situation of a virus, which was said in the
Well, it comes
introduction.
across like
Our
he's
government
undermining the
is very
situation,
well
Nirma. And
prepared.
I mean,
So I
you
am
have
clarifying. I'm here to
political party
clarify.
supporters everywhere. I think this is going to go down the same way, that this was an insensitive remark. And Nirma, you've been on this show so many times, holding
Yes.
other people and other politicians accountable for what they've
So I'm
uttered,
here.
for their responsible positions.
So I'm here giving you a clarification, which you, if you are receptive to, will be way more. It'll be better to have a dialogue on the fact that sometimes people say things which are misunderstood. I'm certainly reasonably sure he meant that it is not an alarming situation, which is factually true. When it comes to the government, we are all ready for the beds, the setups, the medical facilities, the vaccination. We are fully geared, and we are praying that this COVID dies a natural death, because it doesn't. And as the chief minister rightly said, the season is such that the cases are getting aggressive or not aggressive, we will know with the scientific data. But we are encouraging all scientific data to come into play,
All right.
so that we are very, very ready. And I can make a very responsible statement on your channel that our government is fully prepared for this COVID virus.
All right, but with this statement, what comes across is that the left hand, which is the bureaucracy, which is also opening these new COVID wards, is not essentially in sync with the right hand, with the minister saying that there is no COVID or hawa banaya ja raha hai. I do agree, and there is no need to, spread panic amongst the viewers
Yes.
right now. Things are under control, and we have full faith in what the Ministry of
Yes.
Health and Family Welfare is doing at this point in time. But these kind of statements, they just don't sit well. Dr. Nimi Rastogi, spokesperson of the Aam Aadmi Party, many thanks for patiently waiting. How do you look at these statements coming from the Delhi's health minister? Even the chief minister was around when these statements were uttered.
Absolutely. So ignorance of a person who's sitting at such an important post, and he's responsible for managing health of 3 crore people, saying that there is no COVID, categorically no COVID. It can have a cascading effect. It can give a false sense of security and false sense of bravado to people, saying that minister साहब कह रहे हैं कोई COVID नहीं है, so there will be there is no need to practice social distancing or hand hygiene or the basic parameters that we employ. So they should think and speak. They should have their press release ready. I'm in a private setup, and the number of fever cases are on the rise. This is not a season for fever. This is supposed to be healthy season, but the number of influenza cases actually makes us raise our eyebrows. Like the whole families are falling sick. I know it is mild. I know it can be tackled. We are much wiser now. We know immunosuppressant people, and there are some people with comorbidity, they are at risk. But coming from the chief, coming from somebody who should actually go around the hospitals, dispensaries, private clinics to see the actual situation, to manage the mock drills. If he's saying hawa bana hua hai, so you get the message loud and clear that he knows nothing. All the variants and all, they mean nothing to him.
Yep.
He's hugely
And I agree. Neoma, see, again, we don't want to politicize the entire event. It could come across that, my own, perspective tilt might be siding with the Aam Aadmi Party right now. But
That's
I mean,
absolutely
even
fine.
if I try to, give this an emotional quotient, because what do you say to the thousands of people who lost their loved ones? I lost a couple of friends as well. What do you say to those people who might be listening to the health minister saying that hawa banaya ja raha hai? There is no such thing as COVID. ये विषय ही नहीं है. ये तो विषय ही नहीं है.
Can I just speak now?
How it starts.
So just to tell you,
That's
COVID
how it starts.
was a serious pandemic for each and every one of us. If we didn't suffer from it physically, we all suffered from it psychologically. So nobody over here is underestimating it or underplaying it. We are very clearly saying, and I speak on behalf of the government, as I said, in a responsible manner, we are making clear that every setup is ready, and praying to God with utmost every chamber of my heart that this doesn't become a pandemic, because as I told you, the WHO said that this particular variant is one which is very much in control, speaking from the scientific part. In fact, we've gone a step further, that when we've given our advisory, that it mandates that sending positive samples for genome sequencing to the Lok Nayak hospital for variant detection and reporting it to the state surveillance unit to really get to the bottom of it. So there is an entire scientific setup happening. Please, nobody is ever going to say that COVID, nobody's going to make fun of it, as you said, or make a joke of it.
But
or
your
say,
health minister just did,
no, let me
Neoma.
finish. Please, can I finish? I am reasonably sure his statement implied one thing, that it is not alarming. Other than that, there is nothing to analyze or break down in that. You please see the government setup. You please see the steps which are being taken by the government. And instead of holding on to one word, please see the larger picture and the correct picture. Additionally, please understand about 1,000 crores have been allotted to the fast track of construction of more than 10 hospitals. All this is done in the larger interest of every health factor of every person in this city and country. So let's not just forget what is being the action taken and hold on to something which was not meant or interpreted in the way it's supposed to. Our government is an exceptionally responsible government. Please don't forget, it is under Narendra Modi's government that the number of COVID vaccinations kicked in and were taken into consideration and exported. So you're talking to a government of that nature. So please don't malign those intentions of ours. However, I'm very reasonably sure meant it is not alarming in a local way.
But is it fair for a health minister to be calling it that?
Is it the health minister is doing his job? He is doing
and
his
you know what,
actions.
Neoma,
He is ready with the
you've got to understand that we could have cut that entire portion and just played the Hawa portion. We even incorporated the part where the health minister says that there is no need to panic, and that's the right foot forward. The health messaging has to be positive. It has to be positive.
Absolutely, and that is the honest foot forward. As I told you, as I read out the technicals of the WHO, thank you God that this is not an alarming part of the Orient or the what is it called, variant of the COVID thing. Still we are prepared. Still we are taking charge. Still we've issued advisories. We are all geared to go, but it is not alarming, and I'm pretty reasonably sure that is what he meant to say.
Well, all right. You're talking about so much of money that is being spent, the advisories that have been issued, and then this statement comes across. I know you're trying to defend the health minister, and I've been saying it right from the start, that the intention is not to malign the efforts of the central government and the various state governments. We have to fight this all together. And just like the Aam Aadmi Party spokesperson was also saying, that we're wiser now. And we do have faith and trust in the central government. But these kind of statements, they just don't sit well. All right, we're going to wrap up this segment without politicizing it further. Nimi, coming back to you, just a quick 30 seconds. How do you sum up this entire episode?
See, the government should have the scientific temperament to deal with the pandemic of this nature. Their technical know-how and the minister's knowledge should be up to date. And they should not take it so superfluously as to say things like that. Even the chief minister was there. If the chief minister was there, they could have retracted the statement. They still can retract the statement and issue a full public notification or apology saying that yes, there is a need of concern. Everybody be on guard. No need to
There
panic,
is no reason of concern. It's not alarming. It is something which has to be controlled.
Spokesperson saying and quoting certain theory, and a minister and the chief minister not saying anything or saying just on the contrary doesn't make sense to me. I mean, it is not Neoma's words that can supersede the blunder committed by the health minister, who I expected better, who I expected to have some scientific knowledge about what the variant is, how it can backfire, how it can thousands of people.
So a couple of things.
See,
the pressure is not for the health minister to retract his statements. Neoma, telling you again, I know I speak for the entire country here when I say that we have pure faith in what the central government has been able to do with our vaccine diplomacy and how we tackled COVID head on as well. And now that we're wiser, it's going to be a better foot forward. But whether this is derogatory or not, whether this is going to, spread panic amongst the people. This for sure was an insensitive statement coming from the Delhi Health Minister at a time when COVID cases are on the rise, and coming from somebody who's in charge of our lives, our health, it doesn't really sit well. But on that note, many thanks for speaking to us.